Contributions of Sigmund Freud to psychology. Sigmund Freud is the father of psychoanalysis school of thought in psychology. Techniques used by Sigmund Freud. Hypnosis. Hypnosis, also referred to as hypnotherapy or hypnotic suggestion, is a trance-like state in which you have heightened focus and concentration. Hypnosis is usually done with the help of a therapist using verbal repetition and mental images. Hypnosis allows you to be more open to suggestions to making healthful changes in your perceptions, sensations, emotions, memories, thoughts, or behaviors. The history of hypnosis dates back to the late 18th century when Franz Mesmer, a German physician, developed mesmerism, his beliefs about the balance of magnetic power in our body, using animal magnetism. At first, Freud was an enthusiastic proponent of hypnotherapy. He initially hypnotized patients and pressed on their foreheads to help them concentrate while attempting to recover, supposedly, repressed memories, and he soon began to emphasize hypnotic regression and abreaction, catharsis, as therapeutic methods. Catharsis. The term itself comes from the Greek catharsis, meaning purification or cleansing, the process of releasing, and thereby providing relief from, strong or repressed emotions. The term was first used in a psychological context by Joseph Breuer, a colleague and mentor of Sigmund Freud, who used hypnosis to cause people to reenact traumatic events. According to Breuer, when clients were able to freely express the emotions associated with repressed traumatic events, they had a catharsis. In psychoanalytic theory, the word catharsis has been used to refer specifically to the discharge of previously repressed affects or emotions connected to traumatic events that occur when these events are brought back into someone's consciousness and re-experienced. For example, experiencing stress over a work-related situation may cause feelings of frustration and tension. The term has been in use since the time of the ancient Greeks, but it was Sigmund Freud's colleague Joseph Breuer who was the first to use the term to describe a therapeutic technique. Breuer developed what he referred to as a cathartic treatment for hysteria. His treatment involved having patients recall traumatic experiences while under hypnosis, by consciously expressing emotions that had been long repressed. Breuer found that his patients experienced relief from their symptoms. According to Freud's psychoanalytic theory, the human mind is composed of three key elements: the conscious, the preconscious, and the unconscious. Freud believed that people could achieve catharsis by bringing unconscious feelings and memories to light. This process involved using psychotherapeutic tools such as dream interpretation and free association. In their book Studies on Hysteria, Freud and Breuer defined catharsis as the process of reducing or eliminating a complex by recalling it to conscious awareness and allowing it to be expressed. Sigmund Freud developed free association to help clients break through blocks caused by unconscious trauma and resulting defenses. Free association is a basic process in psychotherapy, in which the patient is encouraged to verbalize without censorship or selection whatever thoughts come to mind, no matter how embarrassing, illogical, or irrelevant. In free association, the client spoke for themselves, rather than repeating the ideas of the analyst. They worked through their own material, rather than parroting another's suggestions. The goal of free association is not to unearth specific answers or memories, but to instigate a journey of co-discovery which can enhance the patient's integration of thought, feeling, agency, and selfhood. Freud's eventual practice of psychoanalysis focused not so much on the recall of these memories as on the internal mental conflicts which kept them buried deep within the mind. The use of free association was intended to help discover notions that a patient had developed, initially, at an unconscious level, including projection. Projecting internal feelings or motives, instead ascribing them to other things or people. Resistance. Holding a mental block against remembering or accepting some events or ideas. Transference. Transference occurs when a person redirects some of their feelings or desires for another person to an entirely different person. In psychoanalytic theory is when you project feelings about someone else onto your therapist. A classic example of transference is when a client falls in love with their therapist. However, one might also transfer feelings of rage, anger, distrust, or dependence. Countertransference, which occurs when a therapist transfers emotions to a person in therapy. It is often a reaction to transference. For instance, a therapist's inappropriately disclosing personal information, offering advice, not having boundaries. Psychoanalysis, a method of studying the mind and treating psychiatric and emotional disorders based on revealing and investigating the role of the unconscious mind. Psychoanalytic therapy is a form of in-depth talk therapy that aims to bring unconscious or deeply buried thoughts and feelings to the conscious mind so that repressed experiences and emotions, often from childhood, can be brought to the surface and examined. Talking cure. The talking cure and chimney sweeping were terms Bertha Pappenheim, known in case studies by the alias Anna O, used for the verbal therapy given to her by Joseph Breuer. They were first published in studies on hysteria. Anna was Breuer's patient, who was experiencing hysteria. Breuer had discovered that if he hypnotized Anna, she'd reveal all sorts of information she didn't recall when she was conscious and her symptoms would lessen afterward. This psychoanalytic treatment became popular as talking cure. It is a method of treating psychological disorders or emotional difficulties that involves talking to a therapist or counselor, in either individual or group sessions. Dream analysis. Dream analysis is a technique, originally used in psychoanalysis, but now also used in some other psychotherapies. Dream interpretation is the process of assigning meaning to dreams. Although associated with some forms of psychotherapy, there is no reliable evidence that understanding or interpreting dreams has a positive impact on one's mental health.